In today's COVID-19 update, Health Minister Dr. Frank Anthony says that the government is currently working on procuring COVID-19 vaccines for adolescents, and the second dose of the Sputnik V vaccine should be in the country in a few weeks' time. Minister Anthony, thank you so much for speaking with us today.
Well, thank you very much for having me on the program.
Yes, sir. The first question, COVID-19 vaccines for adolescents. Can we have an update on that?
Well, we have been working to get those vaccines into Guyana. They're not here as yet, but we have been making the preparations for the vaccine. The two vaccines that have been approved for children between the ages of 18 to 12 years are basically the Pfizer vaccine and the Moderna vaccine. And so we're making efforts to get those, and we expect that very shortly we'll have those vaccines in Guyana. When we get them, we'll be working very closely with the Ministry of Education to make sure that we're able to roll this out to children in school. It is a choice, but we hope that parents would understand that for children to return to school, they should be in a safe environment, and we'll encourage them to make sure that their children get the vaccine. Well, these vaccines are quite safe. The literature on Pfizer and Moderna is out there for everybody to scrutinize. It has been used, millions of doses have been used across the world, and the results have been quite good. In terms of administering Pfizer and Moderna to children, because many countries do not have enough vaccines, they have started using the vaccines for their adult population, and I suppose when they get enough, they will then be able to give to their the lower age groups. So I think that's how some countries are approaching it, because there's vaccine scarcity in those countries. In the United States, they don't have vaccine scarcity, and they recognize that if they're going to keep the school system safe, then they need to vaccinate children. And so they have started a program where they're immunizing children in school. The other thing that one would have to understand is that with the new variant, the Delta variant, that is causing a lot of infections in the United States. Those infections are occurring more in the unvaccinated population, and if children remain unvaccinated, unfortunately, they can get infected. And when they get infected, what we're seeing now is not a mild form of the disease in children, but we're also getting a more severe form of the disease in children. So if we are going to stay ahead of the Delta variant, then one of the things that we'll need to do urgently is to vaccinate our children to protect them from this disease. We're working on that, and by next week or so, we hope to get another batch of second dose Sputnik V. Johnson & Johnson as well. We're awaiting a final date when those vaccines are going to get here, but we anticipate that by next week we'll have a formal timeline. As of yesterday, we've had 279,489 persons receiving their first dose of the vaccine. That is now about 57.4% of our adult population. We've also had 146,091 persons who received their second dose of the vaccine, which now approximates about 30% of our population. while it's not the dominant way of transmission, the dominant way to transmit the virus is really through droplets or aerosols. So you breathe that in. But there has been a theory that the virus can remain viable on surfaces. And if you touch those surfaces, then it would contaminate your hands. And when you unconsciously put your hand on your nose or your mouth, then you can infect yourself. So if you were touching people's hands, there is that possibility that your hands can become contaminated and then you can infect yourself. And that's the reason why we try to avoid physical contact.
Well, that's it for today's COVID-19 update. We just spoke with the Honourable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course our social media platforms.